health workplace. So thank you very much.
Thank you, Janet. So this paper is a result of Jamaica's and my research while we worked at HATI, Health Education and Training Institute. And HATI has kindly agreed to keep us involved and engaged to share the results of this work. So to start talking about capabilities for data use in the health workplace, I would like to start with this quite simple image really, but just a way of saying health systems are incredibly complex. We have healthcare and clinical care as the main focus, but really underneath there are many, many services and many people are working in non-clinical roles. If anything became clear for us working in this area during the pandemic, it was in the importance of connection between clinical and non-clinical work. So if someone collects data at any local point, and that is usually a non-clinician, the data feeds into national and international systems and informs very important health decisions. So this is just one example of how crucial the connections are. However, what we have in research in this area is that we have great focus on what is happening in clinical practice. We have a fair bit of research into big data and creating systems for big data. But actually what happens in non-clinical practice hasn't been researched a lot. So in this presentation, I will say a little bit about our study, and then I will focus on traits and capabilities, and also talk a bit about learning needs and training preferences. So, working title of our project is Data Use, or was Data Use in Non-Clinical Practice. And we define data as information selected for further processing, and that's the definition we share with our participants. Our main interest was to explore interactions with data. How do people in non-clinical practice, in non-clinical roles, engage with data? But we also looked into perceptions of skill adequacy and needs, and this is the focus of this talk. A study was conducted at a large Australian public state-based health system. This system has about 120,000 full-time equivalent positions and serves a population of 7 million across a large geographical area, including urban and rural areas. So it's a big system, and our data was collected at some non-clinical sites. So because it was exploratory study, it was predominantly qualitative. We conducted 25 interviews, gathered data from one workshop, and that workshop was about data capabilities in health. And we had altogether 44 participants and 22 hours of recording from qualitative part. And then after that, we followed it up with a survey looking further into some of the issues arising from qualitative study, and it was done at the same sites where we conducted interviews. Overarching findings. Well, firstly, it is that data work is contextual. Our initial idea was that we were going to focus on complex data tasks and routine data tasks and look at their difference. But it became clear very quickly that we can't make that distinction because data work is so contextual. It is really about interaction rather than what's happening with the actual task. So we gave up that idea. We realized that communication, collaboration, and organizational culture have significant impact on data-related work, and that's that context that's always there. We also found that we can't look at data capabilities in isolation. It is a whole range of capabilities and traits, and some of them are not data or role specific, but they do underpin and enable data work. Now, in terms of traits and capabilities, I would like to look at them on a continuum from personal traits via general capabilities to data capabilities. And some of these are somewhere in between, but all these traits and capabilities support and enable data work. In terms of personal traits, our participants talked predominantly about curiosity, interest, and self-motivation as these traits that are driving data work. Thinking in terms of problem solving and making connections, that was very important. And quite a few people who had significant data work and who thought about data work quite creatively had a very broad experience and were exposed to different types of knowledge. So when they talked about intuition as a holistic insight, it was not quite clear whether that holistic insight and intuition comes out of their experience, or they were exposed to all these experiences because these are the experiences that attract them. They also talked about empathy, need to help others, and solve problems from their perspective. Now, how much of that is a result of experience and how much is the way people just were, it's not clear, but our participants often talked about this in relation to this quote, "That's just the way my brain works. This is the way I am." Personal traits are also seen contextually in a sense that whether they're positive or negative depends on the context. And one participant in particular talked about impatience. Impatience is drive to find solutions, impatience to move ahead, but at the same time, in a context where other people are not coming on board, when other people are not following, that's impediment more than a drive. And probably the same can be said about many other traits. A very important trait or general capability, depending on how we look at it, is big picture thinking. Quite a few people talked about big picture thinking. So it is answering questions like, what does it all mean? Am I creating value? How can I make it better? It is about thinking about purpose, about systems, about connections. And this particular quote is from the workshop, and in the context of the workshop, it makes sense because it is about looking at data capabilities in different settings and connecting different types of knowledge. However, this particular way of thinking is very typical of people who emphasize the importance of big picture thinking. Understanding business was another shortcut used quite a few times, and it is about understanding business needs and issues around data use for business purposes. You can think about that as a service orientation. And there are some people who are mentioning examples of data teams, not only in health, but in other contexts as well, people who are very good at working with data, but who have very little sense of purpose and needs of their organization, and hence they're not providing a good service. So really, data skills on their own are not enough. And then another one, analytical and interpretive skills, which enable constructive problem solving. And in a way, we can think about them as application of big picture thinking. It is about problem solving orientation. It is about connecting different tools and different types of knowledge to create a solution. So for example, one participant talked a fair bit about his work and the way he used different types of skills he had to work on visualization. So it is about, in his case, connecting design with programming to serve particular needs. We talked about soft skills a fair bit. They're absolutely crucial. Leadership, negotiation, relationship building, communication. Without them, data work is very difficult. And especially innovative new work is almost impossible without these skills. But one aspect that I found quite interesting, and it captured my imagination, and probably that's partially to do with my current role, was a conversation I had with one data analyst, a young and promising professional who talked about realizing how much he lacks reading skills, that inability or limited ability to read complex academic articles limits his ability to learn on his own, but also limits his ability to draw upon research he would use to innovate or to talk with other researchers in his team. So he had that reflection why that happened and how it came to the point that he had to think how he almost needs to go back to high school and university and go back to some of these readings he missed once upon a time. So, but I thought it wasn't something that was mentioned by lots of people, but I still thought it was an interesting and important conversation we had during the interviews. In terms of direct data capabilities, understanding the whole data process was seen as important. And people would often say that managers who didn't have that understanding were not able to make adequate decisions, very often couldn't see the value of a particular type of work, and would not support their team as needed because they couldn't quite understand what was happening outside their area of direct responsibility. Another area mentioned very frequently were numerical and technical skills. And they were especially mentioned by people who already had them and who thought that they can improve them or thought that other people should have better numerical skills. And one example was that people in human resources need to have decent numeracy to deal with data in an adequate way. They also talked about working with different data in different ways. And again, it is problem solving oriented. And also they talked about some tool specific skills, and Excel and pivot tables were mentioned a fair bit. Now, these insights were followed up in survey, and we wanted to see whether more people actually thought there were issues in the areas we recognized during interviews. So our survey questions actually addressed skill self-assessment, and we also asked questions about data use, particular types of data used in practice. Answers about frequency and importance of data were very similar. It is hardly surprising that most used and most important were organizational data, workforce and financial data, and the least frequently used were patient observation data, which is again quite understandable. Now, in terms of satisfaction with skills, we had a 5-point scale, and on a scale from very satisfied to very dissatisfied, we didn't have many answers on very dissatisfied point, but we can think about satisfied and very satisfied as there's no particular learning need, whereas somewhat satisfied and unsatisfied indicate certain learning need. So when we look at the numbers, we see that understanding the whole data cycle is quite spread across a learning need and no learning need. There is around 50-50 split. In terms of context, organizational context, most people thought they have a good understanding of the context. Then numerical skills were predominantly viewed positively, but 40% of respondents felt a need for improvement. There was a need to learn more. For communication skills, we have this tall spike indicating satisfaction. But also when we look at the numbers, about a quarter, 26%, feel they should or could improve their communication skills. And reading was one of the options in our responses. Soft IT skills had a pretty good spread on both sides. Interestingly, questions about hardware and software were skipped. We don't know why, but the least number of people answered these questions. And then the question about working across different media and formats. We had 39% of people who felt there was a need for improvement. And then we asked questions about preferred ways of learning. And in other questions, we didn't find any difference between men and women, but we did find a difference in answers to this question. The preferred mode was face-to-face, but it was preferred more by women than men. Time given to learn independently was preferred by men. Learn by performing a task was the least popular option. So these are our insights into data capabilities in a nutshell. If I'm to have one last word about what it all means, that would be that data capabilities can't be seen in isolation. And as someone who's worked in high schools, at universities, and in workplace training and professional development, I can definitely see a continuum. I can definitely see that in high school, we can't say someone is very good communicator, they're going to be maybe something, they're going to work in human resources, let's say, so they can live happily without solid numeracy. Or we have someone who is great with programming or great mathematical skills, so we don't have to worry about their limited ability to read complex texts. That actually is not how workplace works. And also at universities, focused very much on vocational skills, focused very much on a particular skill set, are actually missing an opportunity to prepare their students for the reality of the workplace. And that is that they have to do lots of different things and that they need to keep learning. And for the workplace, it is encouraging to see that most people actually are willing to learn and want to learn. But it is quite important to think how we can provide opportunities for people to maybe address some of the learning gaps they have, and how workplace can provide opportunities for constant development. It is very hard to learn new skill set if someone spent years and years and years using a particular tool and working in a particular way. So having that sense of progression and development in the workplace in terms of learning is quite important. So this is all from me, and over to you and your questions.